the people who have died and who are suffering from secondhand smoke and lung cancer. And I see them every day. Secondhand smoke harms people.
The overall cost of health care and premature loss of life attributed to secondhand smoke for Indiana residents was estimated to be $390 million in 2007.
Of the studies conducted and published on the economic impact of restaurants and bars and gaming facilities, 47 of the 49 studies completed to date that we were able to locate concluded that smoking-free laws had no negative economic impact.
Our hospitals and healthcare facilities bear witness to the significant health burden secondhand smoke places on our community. The
Marion County Health Department and the public health structure across the country is charged with protecting public health. Our citizens expect that our public health officials and our hospital officials are behind the scenes, always assuring healthy environments in which we live, work, and play.
70% of adults in Marion County support that sort of an ordinance.
If an adult does not wish to be in a smoking area, they don't have to be.
I'm here to ask on behalf of my sister Hazel and all the other Hazels that you vote to pass into law for all citizens to have a safe, healthy, smoke-free workplace.
I made just as much money then that I do now.
All workers deserve to work in the safest environments we know how to provide.
What is it that really brings someone to your establishments? It's not a cigarette. What they're doing is coming to experience something. You give this city an experience. A cigarette does not.
I think that once club owners and bar owners here see that, that they can attract other types of clientele, that they'll be in favor of this too, because it completely works up and down the coast of California.
I strongly encourage you to pass Proposal 371 covering bowling alleys, membership clubs, and bars.
The data shows that the smoke-free laws are not attributable at all to loss of business in the hospitality industry.
About 70% of the U.S. population already lives in a jurisdiction with strong smoke-free law. Cities like Indianapolis, which still allow smoking in bars, are the exception, the dwindling exception.
I like the idea of being able to leave my home, go to a bar, light up a cigar, watch the local game without that affecting my family at home.
I think it's a property rights issue. I think it's big corporations against small business. Small business wants a niche with tobacco. Big corporations want a level playing field, and they don't want to have to deal with tobacco because that's the perceived popular special interest.
90% or more of my clients smoke.
If you believe it's about public health and the health and safety of workers, then it should include all workers. As former executive director of the Indiana Licensed Beverage Association, I volunteered to help the bars in Indianapolis on this issue, and it's their intention that it's time once and for all for a thumbs up or thumbs down. Let's either say all or nothing. There's no need to further subdivide an already divided industry.
That is not the government's place to tell them and protect them. They should protect themselves, and we should quit being a bunch of nanny staters and telling people how to live their lives.
Council says the majority of those voting governs, and so since it's 14 to 13, it is tabled.
Other than the smoke-free indie group, we don't hear about this. it's not an issue that's really on people's minds as a city. It is a minority of people do ask the question, but across the city, that's not a primary interest. Frankly, that's true.